Okay, welcome to video number 58 of the Diaries of a Coronavirologist YouTube channel. Today is the 21st of April, and for those new around here, I am Stuart. I'm a postdoctoral research fellow who's been studying coronaviruses since 2016, which makes me a coronavirologist. So tonight I want to take a look at some of the information surrounding the AstraZeneca and Johnson&Johnson vaccines and reports of blood clotting. About a month ago, I did a video talking about the AstraZeneca vaccine back when it was first being associated with blood clots, and I took you through how I was thinking about that at the time. Now, as with anything in science, my thoughts have changed and evolved and shifted and adjusted, and so I thought I should go back and sort of revisit this topic. Also, in the intervening time, the Johnson&Johnson vaccine has been paused for its rollout in the United States because of an association with blood clotting, similar to as was seen with the AstraZeneca vaccine. So it seemed like a topic I should go back into. There's also been some recent studies published in the New England Journal of Medicine, which seem to give some potential biological reasoning behind the blood clotting issues that are being found in people who've been vaccinated. So this is starting to paint a picture that indeed, while this is exceedingly rare, it may indeed be linked to the vaccine, and that this could be a case of vaccine-induced thrombotic thrombocytopenia, which I'm going to be calling VITT throughout the rest of this if I use that expression, because it's a lot easier to say than vaccine-induced thrombotic thrombocytopenia, which I had to practice a lot before starting this video. As I say, while it does look like there may be a link with the vaccines, this is still incredibly rare, these events of blood clotting, especially when you compare it to the myriad of issues that COVID-19 itself can cause. People hospitalized by COVID-19, for example, have about a 1 in 5 chance of developing blood clots. Vaccination prevents COVID-19 and everything else, not just blood clots. So in this video, I want to take a look at these ideas that have put out in the New England Journal of Medicine articles. They're linked below if you want to go to them, about the biological effects that could be causing this blood clotting. And I want to talk a little bit about ideas behind risk-benefit. So as I'm saying, these are exceedingly rare, but there is some important risk-benefits to be thought about with regards to the vaccine and the spread of SARS-2 and COVID-19. So I want to take a look at some of those ideas, sort of more a thought-based than a data-based video tonight. A point I'm going to come back to at the end of the video, but I think bears saying twice, is that vaccines work and vaccines save lives. They're protecting you and me, they're protecting everyone around you if you've had it. These side effects are obviously not good to see. We don't want to be seeing side effects. But it's important to stress that they are incredibly rare. If you've had either the AstraZeneca or Johnson&Johnson vaccines more than 2 or 3 weeks ago, this is also not a rare thing you need to worry about either. This seems to come on in that initial period of time after receiving the first dose. And importantly, because we know that there is a chance for this rare condition to appear, we are now better equipped to diagnose it and to treat it to mitigate the more severe sides of it, so the chance of death and things like that. So it's actually good that we are finding these side effects. In an ideal world, there wouldn't be any, but this isn't an ideal world. Anyway, with that point stressed, let's dive into the topic. So just to bring everyone up to speed in case you've been missing it, there seems to be an association between people receiving the AstraZeneca or Johnson&Johnson COVID-19 and developing these uncommon blood clots, or blood clots in uncommon places that are rare. So it seems like somewhere between 1 in 100,000 to 1 in a million people, depending which vaccine and where you look, are developing these rare blood clots. The main one that people are sort of talking about and gets referenced is this cerebral sinus thrombosis. So it's a blood clot in the brain. There's also some in the abdomen that occur. The background rate of something like a CVT, the cerebral venous thrombosis, is about 1 in 100,000 in of itself. So the people developing it who've been vaccinated aren't any more common than the general population necessarily. but there is an association seemingly growing with the people who get the vaccine. So it looks like it could be, as I was saying, this VITT. Of the people who are developing these rare blood clots, it seems so far like about 30 to 40% are dying. But as I'm going to come to, and as I sort of just said a second ago, if now that we know this is what's going on and we know more about how these clots might be forming, we're better equipped to diagnose it and better equipped to treat it. So I suspect that number will decline. The other thing just to point out is there seems to be an overrepresentation of these clots in women aged about 18 to 50. Now, whether that's truly a direct association, whether it's really going on that it's more common in women of that age range, is a little bit unclear because the cases are so rare and so small, such a small number. For example, in Germany, it seems like it's been all women who've developed these clots. However, in Germany, there has been a push to vaccinate healthcare workers with the AstraZeneca vaccine above anyone else, and the majority of the healthcare workers who've received it are women. So because it's small numbers, these kind of things can be skewed. So we can't really make broad claims at the minute about gender and age and risk factors like that. All we can say is that these blood clots are rare, somewhere between 1 in 100,000 and 1 in a million people. So that's just a little bit of the background to bring everyone up to speed if you've not been following this story. But what's come out and what's made me think a little bit more that maybe there is a link to the vaccine is some of the studies that have been published in the New England Journal of Medicine. Like I say, they're linked down below in the description if you want to go and look at them. I'm not going to go into them in too much detail because, to be very honest, this is all somewhat at the very periphery of my knowledge. I don't know a huge amount about blood clotting, and I honestly don't have enough time to go and study it in depth. I know enough to get by, I've read around enough to be able to talk about it, but my area of expertise is how viruses infect cells, and I think more, therefore, about the viral infection and the vaccines, and that's, of course, what I want to talk about tonight. So the two studies were kind of similar. They took about 20 to 30 people who had been vaccinated and who developed these rare blood clotting issues, the CVT or the ones more in the abdomen. And they looked at what kind of diagnostic markers they might find in those people that could give them a clue as to why there could be this link to the vaccine and blood clotting. It was in these studies that they found that the onset was generally between about 6 and 14 days. One of the studies, for example, the median onset was 12 days after the vaccine. And they found that the symptoms or the syndrome that was appearing in these patients looked like another syndrome referred to as heparin-induced thrombocytopenia. So thrombocytopenia being a low platelet count. So this matches what's been seen in the reports of people who've got the vaccine and not been studied as extensively as was done here. So people are developing blood clots and simultaneously have a low platelet count. And this is similar to this heparin-induced thrombocytopenia, or HIT. They found that it wasn't exactly the same as HIT. It didn't score positively in the assays to work out if it was HIT, I guess. But they did importantly find that the majority of the people in their studies, about 20 to 30 people that they were studying, had antibodies against a protein called platelet factor 4. So this is a protein associated with platelets and associated with blood clotting. So what this points towards is an idea that the people who've received the AstraZeneca vaccine, specifically in this case, this was only on AstraZeneca, have developed antibodies that target a protein associated with platelets. They are then developing blood clotting problems and have low platelet counts, and this is the rare blood clotting thing that we're seeing in these people. However, why this happens isn't clear. So the studies were looking at these markers associated with the vaccine-induced thrombotic cytopenia, and without any mechanistic detail. So they were looking at the AstraZeneca vaccine specifically. So it's possible that it's the adenovirus vector that's causing a problem it could be the spike protein of SARS coronavirus 2, or it could be something else. Obviously, Johnson & Johnson's vaccine seems to be causing similar effects in people. That's also an adenovirus vaccine, but it's a very different adenovirus. So AstraZeneca's vaccine is a chimpanzee adenovirus, Johnson & Johnson's is a human adenovirus. So maybe there's something conserved between them that's causing these auto-antibodies that are targeting platelet factor 4, or perhaps it's something about the spike protein. We don't know. So we're now getting a better idea of the kind of biological diagnostic markers that are associated with this potential vaccine-induced thrombocytopenia. I've got to stop trying to say it, the VITT. That's good news. So this leads me into an idea that actually finding this is good. We now know the kind of diagnostic markers, and we also know the symptoms to look for. It looks like the symptoms appear about 4 days at a minimum after the vaccine is received, and it's things to do with where the clots are occurring. So the clots are predominantly in the head or at the abdomen. So it's headaches, severe headaches that painkillers aren't helping, headaches that don't ease when you lie down, headaches combined with blurry vision, can have nausea and things like that associated, or pain in the chest, difficulty breathing. These kind of things, that length of time after the vaccine, are indicative of maybe there's a problem and you should seek medical help. Because we now have a better understanding of what might be causing it, this heparin-induced thrombocytopenia, that can steer the diagnosis and subsequently the treatment. So we're going to be better equipped to deal with this, which is also very good news. In one of the papers in the New England Journal of Medicine, there was actually even a flowchart laid out, a diagnosis flowchart, which has a branch point based on the levels of D-dimer. So this is something very easy to test for, because all the people that they studied who'd had the vaccine and developed clots had elevated D-dimer. So if there's elevated D-dimer and someone has recently received the vaccine, that's a good indication that they are in that side of this flowchart, not this side. It's also important to have assessed this in the way that's been done, because heparin is often given for treatment of clotting issues. However, heparin would exacerbate things in this specific case. So now it should be a case of treating with an anticoagulant that is a non-heparin based agent. So the more we know, the better we are equipped to treat this. It's also fairly doable to test for the antibodies against platelet factor 4, PF4 as well. So we've now got a much better understanding of how to deal with this situation. So obviously it's already a rare occurrence for people who've been vaccinated, but when it does happen, because of these studies and because we've looked into this, we haven't just hidden the idea that there could be something negative from a vaccine, we're now better able to deal with it and hopefully mitigate the severe consequences from these clots. And this also illustrates a point I've talked about many times on the channel regarding vaccines, in that just because these vaccines have gone through their phase 3 trials, they aren't just ignored now, they aren't just assumed to be fine. They are continually assessed at every step along the way to make sure they're still safe. That's why they're called emergency use authorization. They're only at this stage because of the COVID-19 emergency they're dealing with. We're in essentially a phase 4 period now where we're assessing them in everyone who's receiving them to look for anything. The fact that we found such a rare occurrence, and this is the main thing that we seem to be finding, this is actually good news. 1 in 100,000 to 1 in a million is low odds of something being dangerous. Now that's not to mitigate it for every individual person who suffers this. Of course, every individual case is a tragedy. But the fact we're finding this is good moving forward because of better diagnosis, better treatment to mitigate the problems. However, that does bring me now to the idea of risk-benefit and the assessments in that kind of area. So 1 in 100,000 to 1 in a million is very rare, but it's not completely negligible. It's still people who are going to have issues from blood clotting that might be associated with the vaccine. I've tried to keep saying might because it's really hard to draw firm conclusions from such rare events. There's been under 300 total cases of this blood clotting, I think, from 34 million doses of the AstraZeneca vaccine and 7 or 8 million or so Johnson&Johnson. So it's really hard to draw firm conclusions about whether there is this direct association. But there is evidence suggestive that maybe they are linked, and we should therefore assess it. Which, like I say, brings me into this idea of risk-benefit. So COVID-19 is, of course, a huge risk. As I said earlier, people who are hospitalised by COVID-19, 1 in 5 of them develop blood clotting problems that can be life-threatening. A vaccine prevents COVID-19. If we just look at the death toll versus the case toll from today on any of the tracking sites, it's about 2% of the people who've been diagnosed have died. That's 2 in 100 people. That's a lot more risk than 1 in 100,000 to 1 in a million. And I still suspect that the case fatality rate, the number of cases versus the number of deaths, I suspect the actual mortality rate is lower than 2%, but it's still not going to be as low as a 1 in 100,000 or 1 in a million. So the vaccine is definitely beneficial in the context of spreading COVID. COVID is much more likely to kill you, it's much more likely to give you blood clots, it's much more likely to give you long-term lung damage, making you unable to walk up the stairs. It's much more likely to give you long COVID, being that the vaccine wouldn't give you long COVID, and therefore have 6 months of brain fog, where you lose your train of thought constantly. All these kind of things that are associated with COVID are much more likely to occur than this vaccine-induced, no, I can't even try that again, VITT. I'm going to stop trying to say it. It's too many words for my non-medical brain. I apologise. But the vaccine clearly has a benefit over the risks that are associated with COVID or the risks that are associated with the vaccine. However, the interesting thing to then think about, and an important thing to think about, in my view, is that's only in the context of COVID actively spreading. If you're somewhere like New Zealand, where you're fortunate enough that there's no active spread of COVID-19, you've probably got under a 1 in 1 million chance of being infected, assuming you're not jetting off to America, for example. So then the risk-benefit ideas have to shift, and we have to rethink the vaccine approaches. Now, I don't have the answers for this. I'm just going to lay out some interesting thoughts because I think this is an interesting topic and one that's really hard to come to any firm ideas on. So obviously, if COVID isn't spreading in your area, the risk associated with the vaccine may outweigh the risk associated with COVID because you're not going to get COVID if it's not there. However, we're not going to eradicate this virus. It's always going to be there. So that's something that has to factor in to these decisions about the vaccines. The troubling part of it all as well is that unless you're in these super fortunate places that have managed to control the virus through the public health measures, vaccination is a great way to get control of the spread, to bring the level of SARS-2 spread in COVID-19 down to a level where you've got under a 1 in a million chance of being infected. So we need to take the risks associated potentially with the vaccine in order to get the virus to a level where it's spreading so low that the risks of the virus are not outweighing the risks associated with the vaccine. So this makes it a very interesting and difficult situation to think about. And as I say, I don't have any clear answers for this. What I want to do is just lay out some of the thought processes I've been going through about this to hopefully help you think about it yourself a little bit more. And why I'm doing that is because vaccines bring out this amazing amount of ire and anger and aggression and polarization, typical of the modern day, I guess. But they come with so much baggage associated with them. And to be honest, it's partially why I don't particularly enjoy doing vaccine videos on the channel. I much prefer doing other videos like Neanderthal DNA and evolution. But my point there is that any kind of side effect associated with a vaccine, no matter how rare, brings out people in their droves to attack the vaccine, and it induces a lot of fear, which I sort of understand, but I also sort of don't. Any kind of medical treatment comes with side effects. Any kind of drug you may take for anything has a list of side effects. Not taking a drug has side effects. Just living has side effects. If you live long enough, you'll develop cancer. If you live long enough, you'll die. But for whatever reason, vaccines, even though they have side effects that are probably less common than most prescription drugs, bring out all this extra ire and hatred. And just to hammer home this point about prescription drugs, in the United States, over the last 20 years, the level of prescription drugs has more than doubled. I don't think disease has necessarily more than doubled, but that's a whole different question. And around 50% of Americans, if not a little bit more, have taken a prescription drug in the last 30 days. These all come with huge lists of side effects. There's only 2 countries in the world that allow advertisements of prescription drugs, one being the United States, the other being New Zealand. And I know I have a very international audience, so this may not be something you're aware of, but just watching 1 or 2 of those adverts and seeing the list of side effects associated with prescription drugs boggles the mind. And often they're more common than those associated with a vaccine. So what I'm trying to get at here with this idea is that there's a lot of other risks associated with a lot of things, and yet vaccines seem to always draw a very different emotional response. I think part of that comes down to the fact that vaccines are an optional thing. You opt in to take this vaccine as a preventative measure. By and large, there are some mandatory vaccines, I guess, but for the most part, you opt in to take something preventative. So you may never experience the disease that the vaccine is preventing. So someone may never experience measles, or they may never experience, well, they definitely won't experience smallpox. They may never experience COVID-19 because of vaccines. So it's harder to assess the benefit that the vaccine has provided compared to the risk. If you take for example, some heart medication, because you've got high blood pressure, you may notice a tangible change in how you feel in just a couple of days, and therefore people are much more prepared to deal and to accept the risks because they have a noticeable benefit. From a vaccine for COVID-19, there may not be such obvious noticeable benefits because that person hasn't experienced COVID-19. They may not even know someone who's had COVID-19, or at least a severe case. So why I'm bringing up these ideas is because this is the kind of thing that has to be thought about when assessing these vaccines. The AstraZeneca vaccine and the Johnson&Johnson vaccine have both had pauses to the rollouts. Now, I think there's risk associated with that pause because that means fewer people are going to be vaccinated while the virus is still actively spreading. But obviously those kind of assessments have to change if we can manage to get this virus under control. And it's important to think about all these kind of reasons why people do and don't take vaccines as well, in my opinion. So now just to hit my last couple of ideas before closing out the video, I want to circle back to talking about the fact that we need people to be taking the vaccines and understanding the risks and being able to critically assess them. Because without people taking the vaccine, COVID cases aren't going to go down in countries where the public health measures didn't work, such as America and the UK and parts of Europe. This means that vaccines are inherently altruistic to take. You are taking some degree of risk, a 1 in 1 million chance of a blood clot for the Johnson&Johnson vaccine, for example. You're protecting yourself, but you're also helping to block the spread of the virus. The more people that are vaccinated, the fewer people there can be infected by the virus, and the chain of spread gets broken down. And that's the idea behind herd immunity. There are people out there who can't be vaccinated for medical reasons, and there's people out there who won't be vaccinated for whatever reason they choose that to be their decision. So we need people to actually go out and take the vaccines. And therefore this is why I'm glad that we're actually finding these side effects in that strange silver lining kind of way. Knowing what the risks are allows people to make better informed decisions. Knowing what the risks are allows doctors and healthcare professionals to mitigate those risks and better diagnose and better treat them. So I think it's actually good that we are finding these side effects and knowing the levels of risk associated with them. In my case, I received the Moderna vaccine. I've had both shots a couple of months ago now, and I would do that again if I need to. I would also happily take the Johnson&Johnson and AstraZeneca vaccines as they are now, if they were actually going into people. I think on Friday this week, so the 23rd of April, is when there's a meeting to potentially bring the Johnson&Johnson vaccine back out, for anyone that was wondering. But if it were me, I'd still be happy taking those risks. As ever with my channel, I'm not trying to convince anyone one way or another about vaccines. I'm just trying to convey information. Typically I try and convey just pure scientific information, but tonight I've kind of gone a little bit into bioethics, I guess. But ultimately, the channel is here to try and inform people, give them information, and hopefully allow them to come to more informed decisions themselves. With the information that's out there now about a potential, and I keep stressing potential, link between the AstraZeneca and Johnson&Johnson vaccines and blood clotting, hopefully I've given you some food for thought about what that may mean for you or other people you know, and allow for some more information to spread. Let's stop coronaviruses spreading and spread information instead, I guess. Now my final point, I said I'd come back around to it, is to really reiterate the point that vaccines work and vaccines save lives. We don't want to be seeing these side effects, but it's really good that we know about it, and we can now assess risk and we can really think about it critically, and hopefully I've conveyed that to you. Again, to reiterate the point, people who've already had these shots, the Johnson&Johnson AstraZeneca, who are more than 2 to 3 weeks out from it, this isn't something that need concern you. It seems to only be on the first shot and within that time frame because it's this autoimmune disease. The fact that we know or have a better idea of what's causing it and the things that can allow for different diagnoses, that idea of the flow chart I was talking about earlier, means that doctors and healthcare workers are better equipped to treat this and mitigate any problems that come from it. So knowing this, we are in a much better position moving forward. And again, I think I've said it enough through the video, but to really stress it, this is a very rare side effect that's potentially associated with the vaccines. With all that said, thank you for watching. If you found the video useful and interesting, please drop a like for the YouTube metrics. Please leave questions and comments down below. I'm strapped for time, but I do try and get to them eventually. Just please be patient with me if I'm a bit slow responding. I do try and get to the majority of the comments and the questions. If you're new around here and you found the video worthwhile, please subscribe and share with a friend. And as always, please stay safe, wash your hands, wear a mask, and keep calm and carry on. We will get through this pandemic.